Hi friends, Nurse Stef here at Dr. Nichols' office. If you've signed up for a facelift or a neck lift with Dr. Nichols, here's what you can expect over the next 7 days. So day one, the morning of your procedure, you will be meeting us at AMG, Advanced Medical Group. This is a building that has the Advanced Surgical Operatory in it. It's a fully accredited facility, and we'll meet you there the morning of. What'll happen is that we'll put you into a pre-op area first, where Dr. Nichols will do final markings and final tweaks that need to be done. We'll also have you meet your anesthetist during that time. When you wake up, you will feel very groggy. That's totally normal. Dr. Nichols will go ahead and give your caregiver a call the second the surgery is done to let them know that everything went well. They will keep you in recovery until you feel ready to go up and going. Now, we do ask you to stay in town for the first 24 hours after the surgery. So if you don't live in London, we recommend that you either rent a hotel, or if you decide to, you can stay at the surgical operatory. They do have a private suite that you can rent there as well. Now, you will also wake up with a garment on your face that's stuffed with a whole bunch of gauze. And this is what it looks like. You have to wear this garment 24/7 for the first week. Dr. Nichols and the rest of the team, of course, will be available to you via phone if you have any questions that we can help answer. Now, contrary to popular belief, a facelift actually isn't very painful. Due to the nature of the surgery, you're actually pretty numb afterwards. And most of our patients don't need any strong painkillers. That being said, you still have some just in case you get some breakthrough pain. So the morning after your procedure, we will see you back in clinic in the office that you had your original consultation in. So we will not be seeing you at the surgical center. It will be back in office here on 526 Oxford Street East. And what will happen is that we'll take your bandages off, we'll check your incisions, and we'll assess your facial nerve to make sure everything is as planned. What will also happen is that we'll teach you how to do your own wound care. Don't be scared, it's not as crazy as you think it is. So day 3 is all about resting, getting rehydrated, getting yourself nice and fed, and doing your wound care twice daily. Of course, you can see us as often as you'd like. If you don't feel comfortable doing your own wound care, you can have daily appointments with us if you prefer that. We'll be checking in on you via the phone to see if you have any questions or concerns. Day 4, we'll actually be seeing you back in office once again. And this is to remove any quilting sutures that you may have. Not everybody gets them. So this is kind of like an optional appointment. If you have quilting sutures, you must show up. If you don't, you can skip this one. So if you feel comfortable doing your own wound care and you don't have any questions or concerns, we don't really need to see you back until about day 7 or day 8, depending on scheduling. And that's the big day when the sutures finally come out. The suture removal itself is a bit of a lengthy appointment. It takes about 45 minutes or so for us to remove all the sutures that need to come out that day. After the sutures come out, you're also finally able to wash your hair. Dr. Nichols prefers to keep the incisions dry for the first week, so washing hair can be a bit challenging there. So your safest bet would be to just let it go and wash the hair once the sutures come out. The other thing that'll change is that you can wear this compression garment only at nighttime now. You don't have to wear it 24/7 anymore. That being said, some people have swelling that lasts a little bit longer, which may call for an increase in the wearing time of the garment. Everybody is assessed individually, but as a general rule of thumb, you can start wearing your garment only at nighttime once the sutures have been removed. So that's kind of your first week after a face or neck lift in a nutshell. So to summarize, there's 3 sort of main appointments in the first week. And the first appointment would be the day after your surgery, where we change your dressings and teach you how to do your own wound care. And then the 3rd day after your procedure, where we take out any quilting sutures, if you have them. And then day 7 or day 8, to remove all the sutures along the incisions. Of course, the entire time we'll be closely monitoring you via the phone as well. In terms of activity, we really ask you to stay put and rest for the first week. The first 7 days really are very critical in terms of just resting and letting your body heal. Some people feel so good that they want to get back to their regular activities right away. Of course, you can, run to the grocery store if you need to do that. Like small little things like that, but ideally no vigorous activity. We really want you to be resting for the first 7 days. Most people do really well after the first week after a facelift. You would have finished all the medications that we gave you. The sutures are out, so things are just starting to feel a little bit normal again. If you have any questions, leave them in the comments below.